Good morning, ma'am. I'm going to perform assessment of parenteral administration of drugs, administering IV medications using IV push. And we have the purpose. We have to achieve immediate and maximum effects of a medications. Preparations, we have assessment, assess. We have the appearance of injection site. Injection site. And then we have the specific drug actions and effects response, and we have to take the vital signs for baseline data if the medications being administered is potent, and determine allergies to medications, determine specific drug actions, side effects, normal dosage, and peak action time, and check the patency of the IV medication. And we have the planning. We have to assemble all of our equipment. We have the vial and ampule of normal saline and the correct medication. We have filter needle, and we have 5 ml to 10 ml syringe, and we have 3 ml sterile syringe for flushing, and we have pen, micropore tape, and we have gloves and digital watch. We have to check the MAR of the medication administration orders against the level of the ampule or vial carefully. We have to read the label of the medications, when it is to be taken, before withdrawing the medication, and after withdrawing the medication. We have the implementation and the procedure. We have perform hand hygiene, and we have the and prepare the medication or vial from vial or ampule for drug withdrawal. Prepare the medication. In 1 ml of sterile normal saline, and then our medication is ready. We have to prepare the client and check the client's identification band and explain the procedure to the patient if he or she feel any pain. Good morning, sir. I'm Rowena Doctor, and I'm going to administer medications via IV push, and we have to ask the patient, the client's or her name, or we have to check the rest tag of the patient to identify the patient identity, or if there is any available significant others, we can ask any we can ask the name and the identity of our patient, and then we have to prepare we have to clean the client injection port with antiseptic swab and insert the needle syringe containing 1 ml of normal saline and aspirate for blood. Now the port is clean, and we have to insert the normal saline for flushing and aspirate for blood. Flush the IV saline and lock with the first syringe from contains 1 ml syringe water, and inject slowly and remove the syringe. Inject the medications slowly as the recommended rate of infusion. Use the push-stop technique for central venous catheters. You have to remove the medications and syringe with all medication is administered, and then we have to reflush the IV saline. Repeat the injections with 1 ml saline and remove the syringe, and we have to reflush. Push. And then we have to prepare for the existing IV line. We have to identify the closest injection port, and then we have to clean the injection port using the swab. And then we have to stop the IV flow by closing the clamp. We have to presume that this is the clamp we have to close, and then we are assumed that this is our clamp, or we have to kink the tube. We have to kink the tube, this one, and above the injection port, this, the tube above the injection port to prevent the medication to going up straight to the body and going through the and then we have to connect the syringe to the IV system using the needless system. We have to remove the syringe, then we have to inject the medication slowly at the recommended rate of infusion. Use watch if necessary. You have to inject the medication and slowly release the then we have to release the clamp. After withdrawing the medication, we have to discard our syringe and then we have to release the clamp of the tubing. And then we have to withdraw the syringe or needle, activate the needle safety device for needless system and detach the syringe and new sterile cap of the port. Dispose the materials and equipment used and remove and dispose glove. And we have to perform hand hygiene. We have to document the administration of medications, site, time, dosage, route, and nursing assessment. And we have also observed for possible reaction to the administered medication and or effectiveness of medications at the time and expected to act.